Welcome to Facts TV News, where everything is true. Taxi driver in Washington Boulevard hit and run barred from operating PPV for a year. The taxi driver implicated in last month's deadly hit and run on Washington Boulevard in St. Andrew has been barred from operating a public passenger vehicle for a year as a condition of bail. The order was issued when the accused 42-year-old Godfrey Graham appeared before the St. Andrew Parish Court on Friday. Mr. Graham, who is charged with manslaughter, failing to stop an accident, and failing to report an accident, was granted bail in the sum of $700,000 following an application by his attorney Anthony Williams. Mr. Graham is scheduled to return to court on March 25th. It was reported that on January 25th, a woman was struck by a grey Toyota Probox which sped off. The woman was later pronounced dead. Mr. Graham turned himself into the police a few days later. Man pleads guilty to killing 8-year-old stepson. A 41-year-old man who was charged in 2020 with killing his 8-year-old stepson after the child's mother ended their relationship pleaded guilty on Friday in the Supreme Court. Arches Rose pleaded guilty to the murder of 8-year-old Galen Buchanan. He is to be sentenced on April 1. Prosecutors reported that in January 2020, Rose took his stepson from a house on Penwood Road in Kingston after the boy's mother ended their relationship. He admitted to tying up the boy and dumping him in the sea in East Kingston. Galen's body was found floating in the harbor on January 23, 2020. Rose was held a few days later in Trelawney. Jamaica Fire Brigade now able to fully access high-rising buildings. The Jamaica Fire Brigade is asserting that it has the ability to tackle fires which may take place in high-rising buildings across the island. Assistant Commissioner in charge of fire prevention at the Brigade, Sean Martin, says the capacity to monitor high-rising buildings will also increase within weeks. Mr. Martin's disclosure is in response to recent concerns about the risk of fires due to developers flaunting conditions of their permits or lack of regulatory oversight. Mr. Martin explains that the equipment to respond is already available and strategically located because of the risk assessment in Kingston, St. Andrew, St. Catherine, St. Anne, and St. James. We have 4 hydraulic platforms. These are 2 units that can be extended to a maximum feet of 115, but for safety reasons, we extend it to just 105 feet. You are talking about approximately 9 or 10 floors in terms of capacity. We have capacity. He also said that more regulatory oversights have been added with increased inspections. He disclosed that in a matter of weeks, there will be more fire personnel for inspections and the certification of buildings. We are currently going through restructuring where the government will approve a restructuring of the Jamaica Fire Brigade and the Fire Prevention Division. They will beef up the capacity of this division. Come April 1, we will be employing a compliance and enforcement officer to ensure that we can fulfill our mandate to conduct annual inspections to ensure that buildings are certified, he stated. Jamaica receives more than $80,000 worth of medical supplies. Prime Minister Andrew Holness has welcomed the donation of medical equipment and supplies valued at more than $800,000 by US-based healthcare provider Northwell Health. According to a release, over 1 million items, which include respiratory masks, N95 masks, oxygen concentrators, nasal oxygen, safety eyewear, and protective gowns, were handed over during a ceremony at the Bustamante Hospital for Children in Kingston on Friday, February 11. Holness thanks Northwell Health and logistical partner MedSure for providing the well-needed medical supplies to Jamaica, which will aid in the government's coronavirus pandemic response. One of the most important lessons of the pandemic is that we all are in it together, and what it means is that for those who have resources, who have vaccines, who have supplies, it is also in their interest to share as much as possible. So we are appreciative of this very enlightened approach and this enlightened consideration by our friends and partners from Northwell Health, he stated. The Prime Minister hailed Jamaican-born Director of Patient Care Services at Northwell Health, Dr. Sandra Lindsay, for her efforts in making the donation possible. He noted that Dr. Lindsay had visited Jamaica in 2021 when the country was experiencing the second wave of the pandemic, and she had observed the needs in terms of medical supplies and made a commitment to assist. Dr. Lindsay made history on December 4, 2020, when she became the first person to receive the COVID-19 vaccine in the U.S. She has been a shining example of exemplary civic service and has been promoting the message of public health and the importance of vaccination, Holness said, while thanking Northwell's leadership for being receptive to Dr. Lindsay's call to provide support to Jamaica. Minister of Health and Wellness Dr. Christopher Tufton also expressed appreciation for Northwell's donation, noting that it could not have come at a better time. While we're seeking to back at the fourth wave, we want to also use the opportunity to send a very strong signal that COVID is still with us and still presents a threat. It is our duty as a responsible government, as a ministry, to reinforce that message even while we see the progress that we are making, he said. Dr. Tufton noted that the donation complements the government's ongoing effort to keep the public safe by ensuring that adequate supplies of oxygen and other critical pieces of equipment are available to support the work of the personnel in the field. President and Chief Executive Officer of Northwell Health, Michael Dorlin, who joined the ceremony via video conferencing, said he was delighted that the entity could assist. Tufton urges proper disposal of face masks. Minister of Health and Wellness Dr. Christopher Tufton is urging citizens to properly dispose of used masks to prevent potential environmental hazards. Dispose of them in a way that preserves the environment. I have seen articles popping up globally around improper disposal and masks ended up in waterways or the marine environment and so on, he noted. It is a dilemma, another side effect of the coronavirus pandemic and the response. Every action has a reaction, and so we have to balance out all times and manage the process, he added. Dr. Tufton was speaking at the handing over of 2 million masks to benefit schools, frontline personnel, community responders, and other vulnerable groups at the Pegasus Hotel in Kingston on Friday, February 11. Regional Environmental Health Officer for the Southeast Regional Health Authority, Paul concurred with the minister, noting that improper disposal of masks contribute to the degradation of public health in general. There can be droplets still in the mask, which would be dependent on the time factor, but also just the proliferation, the tonnage of waste, which, less indiscriminately, will also pose a problem to the environment and public health in general, he said. Paul stated that used masks should be bagged and placed in proper garbage receptacles, where they can be transported to an established place that disposed of waste. Health Ministry distributes 2 million masks. The Ministry of Health and Wellness has distributed 2 million disposable masks to several key entities and vulnerable groups to aid in the prevention and control of the coronavirus. The items procured from various international partners through the National Health Fund (NHF) were handed out during a ceremony at the Pegasus Hotel in Kingston on Friday, February 11. They will benefit schools, frontline workers, church groups, vulnerable populations including persons with disabilities, among others. Health Minister Dr. Christopher Tufton, who made the presentations, said that mask wearing has been a highly effective response to the COVID-19 pandemic and urged citizens not to become complacent in this regard, even as the country approaches the tail end of the fourth wave. I have to continue to drive the message around the need for us to remain vigilant, to follow the protocols. I am also desirous of restoring normality and the way of life as we all know it, but also have to accept the realities, he said. Minister of Education and Youth Favour Williams, who received a share of the donation amounting to 400,000 masks for distribution to schools, said that the items will be critical as full face-to-face classes resume. We certainly want to ensure that our children, teachers and the public have the resources needed to mitigate the spread of the coronavirus. The health and education of our children is a collective national responsibility, she noted. Meanwhile, Chief Executive Officer of the NHF, Everton Anderson, said the entity is focused on meeting the various needs in the pandemic response. Since the pandemic, our agency has partnered with approximately 80 different countries to bring supplies into Jamaica. It has been a challenge, but we could not have done it without partnership, he noted. 154 new COVID cases, 18 more deaths reported. Jamaica on Friday reported 154 new cases of COVID-19, bringing the total number of confirmed cases reported on the island to 126,886. According to the latest statistics from the Ministry of Health and Wellness, the country also reported 18 more virus-related deaths. The death toll since the start of the pandemic now stands at 2,738. Of the newly reported cases, there were 96 females and 58 males, with ages ranging from 67 days to 108 years. The cases are recorded in Clarendon 2, Hanover 4, Kingston and St. Andrew 23, Manchester 15, St. Anne 18, St. Catherine 31, St. Elizabeth 18, St. James 15, St. Mary 2, St. Thomas 8, Trelawney 9, and Westmoreland 9. The latest victims are a 91-year-old male from Westmoreland, whose death was previously under investigation, a 66-year-old male from Westmoreland, a 64-year-old female from St. Elizabeth, a 69-year-old male from Westmoreland, a 39-year-old female from Westmoreland, and 67-year-old female from St. Elizabeth. These deaths are said to have occurred in January. A 66-year-old female from Kingston and St. Andrew, whose death was previously under investigation, a 75-year-old female from Kingston and St. Andrew, whose death was previously under investigation, a 93-year-old male from Clarendon, an 87-year-old male from Westmoreland, an 85-year-old female from Westmoreland, a 79-year-old male from St. Elizabeth, a 71-year-old female from Kingston and St. Andrew, a 92-year-old from Kingston and St. Andrew, a 76-year-old male from St. Thomas, a 69-year-old male from Kingston and St. Andrew. These deaths are said to have occurred in February. 2 other deaths were under investigation from 2021. They are a 28-year-old female from Hanover and an 87-year-old male also from Hanover. The country also recorded 375 new recoveries, bringing the total number of recoveries to 72,949. The country's positivity rate now stands at 15.3%. There are confirmed 2,199 active cases on the island. Please remember to subscribe, like, share, and click the notification bell for daily updates.